Hi, I'll just wait a few moments for some people to come on. Hi. Oh, here we go. Hi, Annie. Hi, everyone. Thank you so much, everyone, for joining us today. This will be our final part of series with NeoGenesis. So in a few moments, I will be welcoming Pam Vendetti back on with me. She is the head of education at NeoGenesis. And today we're going to be looking at signs of aging and pigmentation. So let me see if Pam is available. To see if she is here as yet. See. Okay, she isn't as yet, so not a problem. We'll just wait a few more moments, and I think she might be here now, actually. Sorry, bear with me. Let's see. Yes, here we go. Okay. It's just connecting. Hi, Pam. Hi.
Hi, Lucy.
So lovely to see you again. How are you?
Oh, I'm doing great. How are
Great.
you?
Yeah, I'm well, thank you. I'm well. So, Pam, I was just saying, looking at sort of aging and pigmentation today. So, huge topics, aren't they, within the skincare industry? I mean, we could probably be here all day talking about them.
Oh,
And so I thought it'd be a great idea to sort of focus really today on inflammation and how that has an effect on aging and pigmentation, and how we would sort of manage that. So if we start with aging, these are, you could split sort of aging really into two categories. So you've got intrinsic, which is sort of internal factors. So you're looking at things like hormones, genetics, our biological age. And these are things that we really can't have much of an influence on. These are a natural part of life and already sort of predetermined. Intrinsic aging, however, which is external factors, so things like pollution, smoke, diet, sun exposure, which is a big one. This we can have more of an influence on, and really these factors do cause inflammation within us. Something that we call sort of free radical damage within the skin, and this inflammation, it accelerates aging, essentially. So what we're sort of trying to do is to slow down that acceleration, and we can do that in sort of taking a 360 approach to aging, is what we would sort of say to our clients. So looking at it holistically, so looking at a good diet, one that's sort of rich in vitamins and antioxidants, getting a good night's sleep, not smoking. I would say not drinking alcohol, but that isn't something that I do personally. So just reducing alcohol as much as possible. And topically looking at skincare and how we can reduce inflammation and manage free radical damage. So is that something that you would say NeoGenesis is part of their aging approach to aging, essentially?
I would say it's almost the top priority because
Mm,
we know what inflammation does both to our skin and our bodies. Like
yeah,
every disease has a component of inflammation to it.
absolutely.
So, one of the most important things we can do is reduce or eliminate that inflammation in the skin. And
Yes.
so, the stem cell molecules that you find in the NeoGenesis products, they are brilliant at doing that. They go right to the source of inflammation and begin to quell it by feeding the skin all the nutrients it needs to overcome that inflammation.
Yes.
And like you said, it comes from such a host of areas. Even some of the beautiful but more assertive treatments we do to our skin can leave some underlying inflammation that we
Yes.
may not even know is there. So I love knowing that by applying these serums, I'm addressing what I know and what
Mhm.
I don't know in terms
Yeah.
of what's causing inflammation.
Yeah, absolutely. it's all around us, inflammation, isn't it? So
Yeah.
absolutely, prevention and managing that is the best way to help with aging concerns that people may have. And really sort of, so I suppose the first signs of aging that you might see, you're looking at sort of, somebody might come to us and they say, you know, middle to sort of late 20s, they're starting to see these early signs of aging. So starting on NeoGenesis at that point is great, isn't it? In terms of looking at, would you say sort of skin serum would be a great sort of way to begin the NeoGenesis journey if you're looking at that sort of age?
I think it's perfect, and it's easy to use. It's lovely to use. It feels
Yeah.
so good on the skin, and it's really all you need. And that's that time we talked about, that gap before, where the damage is here, but our body starts to lose the ability to stay even with it. So we start to have that gap.
Yes.
And that's where the skin serum comes in and says, here, let me make up the difference for you and take care of both the damage that's happening currently, as well as repair damage that's happened in the past that hasn't been repaired yet. So it's a beautiful way to start your skincare journey with really good professional products.
Yeah, absolutely. And I know this is a huge question that we get asked for people that might have more like lines, wrinkles, or skin elasticity, is the difference between NeoGenesis recovery serum and the booster serum. We get asked all the time, what's the difference and which one should I go for? So in terms of that, Pam, what would you recommend?
That, I get that question all the time
Yeah.
too. So the easiest answer is, the more damage you have, the more molecules you'll want to address the damage.
Okay.
So the more damage or chronic issues such as eczema or psoriasis, you're going to want recovery. Now, that doesn't mean twice a day, every day necessarily. It could be your nighttime serum, and then during the day, you choose your booster or skin serum. It's also hydrating. It also corrects things in real time. So the most damage is recovery. Booster is so beautiful. I like to think of it as an advanced anti-aging serum because at 40%, that's still quite abundant in the number of molecules. And then your hydration comes from sodium hyaluronate butyrate. What I love about that is it's long lasting and it's very anti-inflammatory.
Okay.
So as I think of that, as you're in maybe your late 30s, your 40s, your early 50s, you're really going to want to concentrate many, many changes in the skin, whether you're having children or you're in perimenopause, all of those things accumulating damage. That super wonderful anti-inflammatory hydration along with an abundance of molecules can really address that, and it feels beautiful under makeup, under your other products. It's absolutely lovely. And then skin serum, as you mentioned, for those just starting into their skin journey, and where I also find it's a great way to start with the line because you still see beautiful results. It's also great if you're someone who says, look, I am a skincare minimalist. I want to use products that deliver multiple benefits to the skin. I want a cleanser, I want a serum, and I want a really good moisturizer or barrier cream. Skin serum can be perfect for that. They will still see beautiful results. It's at a very good price point. So they get the result, they get the hydration, they get the benefit of a good cost breakdown, and it's lovely to use. And then they can always, maybe when they come to see you, maybe when they have a treatment, they do a short course of recovery to boost the results. And then they use skin serum to maintain. So kind of like the most damage recovery, sort of those middle-age years, booster is beautiful. And then for the younger people just starting in, or for the minimalist, skin serum is just a beautiful way to go.
Yeah. I know that was really well put, actually, Pam. I mean, I'm using skin serum at the moment, so I'll use skin serum, and then I just top up each week, you know, in a weekly basis on my recovery. So I use recovery
Yes.
3 times a week, and then the skin serum. And
Okay.
I started on recovery, and I think most people do, and then you forget. Sometimes you just don't look at the other serums at first, and then it's only when you sort of think, okay, actually they do have a lot to offer as well. So and that's when using them together, as you say, is the perfect combination.
Mm-hmm.
Yeah, perfect. And so pigmentation again is a huge topic, and pigmentation is so difficult to treat, you know, once you have pigmentation, well, hyperpigmentation specifically, and prevention is definitely much easier to do than once you've got it. And the main sort of factors again with pigmentation, you're looking at sun exposure, injury, inflammation, hormones. And so prevention in terms of, you know, sun protection, and also looking at reducing that inflammation as well is huge. And so would you say again that is NeoGenesis's approach to looking at pigmentation?
Yes, and I will, just a little teaser, we are working on a product to really specifically address hyperpigmentation using our products. But what we have found, for instance, when you're using recovery, you will reduce the inflammation so much that you'll find the hyperpigmentation tends to lose its color. Some of the color is from the inflammation. Mm-hmm. And you'll see the skin start to even out in the skin tone. And so, Lucy, what you might see if you were looking under a magnifying light, you may not yet see a reduction in the size of the pigmentation, mm-hmm. but suddenly it starts to fade out so much that it really blends with the skin. And over time, we have seen one woman in particular comes to mind. She had both melasma and hyperpigmentation. Mm-hmm. After 18 months, not only did it fade, it started to break up. The skin had healed to the point that now not only had it evened, but it was breaking up, and it was smaller and more reduced. Okay. So constantly feeding the skin those good nutrients that it needs to rebuild, healing mm-hmm. the current damage, taking care of the inflammation is a big step. And I don't know about you, but I found in practice, no matter what someone had going on, almost without question, the number one complaint was these dark spots.
Yeah, it's huge.
Right?
Yeah.
No, none of us want those dark spots. We'd rather have a fine line or a wrinkle than a dark spot if we have to choose.
Yeah. True, absolutely. I think and an important thing to mention, because I know recovery is great for sort of post-procedure, because as you mentioned, sometimes you can go for an in-clinic treatment and the result can sometimes be pigmentation because perhaps somebody hasn't prepped properly their skin. I know that in clinic, you know, we're huge on prep because you want your skin to be at its healthiest, its most resilient, strongest. So when you are putting it under this extreme conditions, that it's at its, you know, it's not unpredictable. You know that it's, you know, you're managing that, how that skin is going to react. But some people perhaps, you know, don't do that, and then pigmentation can be a result. And so really recovery is great would you say pre and post? Because I would say
I would.
In terms of, yeah, for getting it at its strongest. Yeah.
Exactly. And the skin loves that. And it does the most benefit. Also, if people tend towards cold sores, mm-hmm. when they have more aggressive treatments, sometimes you'll read that that's sort of a side effect. And if you're on medication, you may want to take it. And recovery really helps with that because it will heal a cold sore like that if you feel one coming on. So it's very preventative that way too.
Okay, great. Pam, I think we've got some questions actually. So if I go and have a look, let's have a look back. So I think there might be yeah. Okay, so First question I've got is, I'm in my early 20s and not seeing any signs of aging. So should I wait to start a routine or start now? It's a question that we've got. So, I mean, my thoughts are, Pam, that I'd say starting now is very important, because even though you don't necessarily see the signs of aging, it is happening. You know, it starts, you know, as soon as we're born, you know, we are aging, you know, because we're
That's
obviously
right.
absolutely. So starting in your early 20s is a great time to start.
Yeah, a lot of times in our teens, even though we're still really healthy and our stem cells are working well to provide that regeneration, we are building up a bit of damage. We're usually taking in, maybe we're not sleeping very well, maybe we have crazy diets, maybe we're out in the
Yeah.
sun feeling free, no
Yeah.
sunscreen. And that's great. That's part of life, but it also starts to damage your skin, even if it hasn't shown up yet.
Yes, absolutely. And, you know, I suppose in terms of NeoGenesis, you know, topically, sometimes when we're looking at aging, we're looking at things like retinols and peeling agents that might have a high percentage. And certainly for younger skins, that's not something when you're a teenager or in your early 20s that you might necessarily need to start. So NeoGenesis slots in really nice as an alternative to really managing aging. Great.
Yes.
Sorry, I've done something here. Let me see if I can see. Sorry, I've put this up there. Oh, here we are, back down. So we've got, will this help with redness around the nose? So I'm thinking that might be just NeoGenesis in general. So again, yes, I mean, it depends sort of, again, what that redness is. It could be potentially rosacea, it could be inflammation that you're looking at. But yes, NeoGenesis is exactly what it does, isn't it, Pam? That it's looking at reducing that inflammation
Yes,
from
definitely.
a host of from skin conditions.
Definitely.
Okay. Is there a product that you would recommend for helping with chickenpox scarring?
You know, I personally really like microneedling with recovery for any kind of scarring.
Yes.
Um, I've seen unbelievable results. I've seen scars that were nearly a decade old, but still red and raised,
Mm-hmm.
be reduced to a skin tone color and much flatter and much less obvious with the use of even a home derma roller and recovery. But definitely using those two together for any type of scarring produces a really good result.
Yeah, and we'd agree. I think in terms of looking at scarring, in clinic treatments with topical is the way to go to maximize the results.
Yes.
Definitely. Okay, let me see. We've got some more questions. I'm using the light moisturizer. Should I swap to intensive while it's the winter? It's another question we've got there. Difficult, isn't it, Pam, to say that one, because I suppose it will depend on somebody's skin type, you know, their oil content within the skin. I mean, if you find in winter that you do get more dry, then yes, that would be, you know, you can switch your skincare routine, you know, according to sort of the seasons. But but some people will still be very oily in the winter and might not necessarily need that extra
That's
hydration
true.
that intensive gives you. Yeah.
One thing I do sometimes, Lucy, is I would keep using the light, but then add the barrier renewal cream, just
Yes.
one pump. So if you know you do really well on the light, you know, moisturizers are a funny thing, especially those of us that may tend towards breakouts and things like that. One ingredient change can make a difference.
Yes.
And what I know is both, for instance, the light and the barrier renewal cream are quite acne safe. So if it's a matter of this is my summer routine and I use the light moisturizer
Mm-hmm.
and now it's turning cold and I'm starting to experience dryness and a different skin, just try adding a pump of the barrier renewal cream right on top of the light moisturizer.
Yeah, that's a great idea. So I've got another one here, which is, which products do which products to rescue a skin laxity sagging on the neck and jawline?
I love recovery for that, and I love microcurrent.
Yes.
I'm a huge fan. You've got microcurrent that increases the ATP, and does all those beautiful things for the skin. At NeoGenesis, we're huge fans of microcurrent.
Okay.
It's a wonderful treatment.
Yeah.
And then when you add in the nutrients of recovery along with that, I think you can get some superior results doing it that way, re-educating the muscles.
Yeah.
I love microcurrent. I did it this morning. It's been a couple of
Okay.
weeks. And I'm like, oh, I'm going to be with Lucy. I'm going to do a little microcurrent.
Oh, brilliant. Yeah, no, it's great if you can fit that in, isn't it? Why not? Oh, great. I think, okay, no, there is. Oh, so somebody's saying, how often would you do needling, micro needling?
If it's professional, I would say 4 to 6 weeks, and maybe consider a series and then reevaluate. What we know about microneedling is it continues to work for another 90 days, rebuilding, stimulating the collagen and elastin. So that's wonderful. If you're doing it at home, if you're using tiny, tiny, tiny needles like a 0.25, you could do it a couple of times a week. And you never want to press hard. Just let the needles do their thing. At home, I personally don't think it's a good idea to ever do more than a 0.5. I like to let the professionals do microneedling for the most part, but it can be done safely. And at a 0.5, never more than once a week, and never press. Don't press. Don't try to get pinpoint bleeding or anything. We don't want to do that at home.
Okay.
But professionally, I'd say every 4 to 6 weeks.
Yeah. Okay, great. And I think this is the last question. So does microneedling work if you have melasma prone skin? And so again, I think it can, but again, for melasma prone skin, the prep that we spoke about is so even more important, isn't it, at that point? Because you don't want to be inflaming that melasma or causing it to become any more. So prep for those people is so important. And again, using a professional, as you said, really being under their guidance is a great way to go if you're looking at that with melasma prone skin.
So true, Lucy. I would never advise anyone with melasma concerns to try to go it alone.
Yeah.
It's challenging, and if it's still active, there's some kind of a hormone imbalance, and a lot of things can make it worse.
Yes.
If it's very active and you do the wrong thing, which nobody wants to do. So definitely get professional advice. And that's the way to go with that, with melasma.
Yeah. Perfect. Oh, lovely. And I'll just say one comment that somebody's put, which is so nice. Somebody says that you've both got such amazing skin. So, which is, again, we both use NeoGenesis. So.
Thank you very much.
Yeah. Thank you, Pam. I think that's all the questions that we've got today. Really, really appreciate the time that you've given us, Pam, and the whole of the NeoGenesis team to be setting these up for us. So it's really great. Thank you all from all of us at Medifine. It's been a really great experience having you on.
We love it. We love working with all of you, and I look forward to more in the future.
Yeah, absolutely. It'd be lovely, Pam. Thank you. And thank you to everyone for joining again and listening. Yeah, it's been great. Thank you. Thanks.
Have a great rest of your day, Lucy.
You too. Thank you very much, Pam. You too. Bye.
Bye.